Welcome to Medic Empire, making medical knowledge easy. Today's topic is croup in children. This lesson is designed for you as a medical student, so we will build from basic concepts and help you understand what you will see in real clinical practice. Croup is a common viral respiratory illness in children. It primarily affects the larynx and the trachea, and sometimes extends into the bronchi. Its medical names, acute laryngotracheobronchitis and acute laryngotracheobronchitis, describe exactly where the inflammation occurs. The term croup comes from Old Anglo-Saxon and Scottish words meaning to cry out in a hoarse voice. In short, croup happens when inflammation and swelling narrow the upper airway, creating difficulty breathing and the characteristic barking cough. Epidemiologically, croup is the most common cause of acute stridor in children, contributing to a significant number of pediatric respiratory visits each year. It mostly affects infants and toddlers, with peak incidence between 6 months and 3 years. Boys are affected slightly more than girls with a ratio of about 1.4 to 1. Although it can happen at any time of the year, it is more frequent during the rainy season. Around 5% of children experience repeated episodes, known as recurrent or spasmodic croup. Croup is caused mainly by viruses. Parainfluenza viruses, especially types 1 and 2, account for most cases. Other viruses like RSV, adenovirus, rhinovirus, coronavirus, influenza A and B, and metapneumovirus can also produce croup-like symptoms. Rarely, measles, varicella, or herpes simplex may be involved. A small number of cases are associated with Mycoplasma pneumoniae, a bacterial pathogen. These infections spread through respiratory droplets or by touching contaminated surfaces and then touching the eyes, nose, or mouth. Croup typically begins like a simple upper respiratory infection. The child may have rhinorrhea, a sore throat, a mild cough and a low-grade fever. After 1 to 2 days, the classic signs appear: a barking, seal-like cough, hoarseness, and inspiratory stridor. Stridor is a harsh, high-pitched sound caused by turbulent airflow through a partially obstructed upper airway. These symptoms are often worse at night. Most cases improve within 3 to 7 days, though mild symptoms may last up to 2 weeks. In more severe cases, children may show inspiratory and expiratory stridor at rest, visible chest retractions, poor air entry, agitation or lethargy, dehydration, and increased work of breathing. Late signs include cyanosis and profound fatigue due to hypoxemia and hypercarbia. Spasmodic croup presents suddenly at night, often without fever, and may recur. Diagnosing croup is mainly clinical. An experienced clinician can diagnose it from the history and physical exam alone. When imaging is used, an anteroposterior neck X-ray may reveal a steeple sign, which indicates subglottic narrowing. However, this sign is not always present and can appear in other conditions such as epiglottitis or bacterial tracheitis. CBC findings are usually nonspecific, although lymphocytosis may suggest a viral illness. Pulse oximetry is typically normal, but still useful for monitoring. Treatment depends on severity. Corticosteroids such as dexamethasone or prednisolone are useful even in mild cases because they reduce airway inflammation and improve symptoms. Evidence shows these medications reduce illness duration and lower the chance of return visits. Nebulized epinephrine is used for moderate to severe cases. It reduces swelling quickly through vasoconstriction and bronchodilation, with effects beginning within minutes and lasting about 1.5 to 2 hours. Children must be observed for at least 3 hours after receiving nebulized epinephrine to ensure symptoms do not return. Most children with mild croup can be managed at home. Useful measures include sitting with the child in a steamy bathroom, or using cool mist, giving warm clear fluids, treating fever with acetaminophen or ibuprofen, keeping the child calm, and elevating the head during sleep. Avoiding smoke exposure is especially important because it worsens cough and airway irritation. Infants can be placed in a car seat to help with breathing. Croup can sound frightening to families because of the dramatic cough and noisy breathing, but with proper assessment and timely treatment, most children recover fully. As a new medical student, understanding Stridor, airway anatomy, and when to escalate care will be crucial in both your training and future practice. Thank you for joining us at Medic Empire, where we make medical knowledge easy. Do well to like, subscribe, and share.